Does my child have autism? Well, before we get into that, let's talk about what autism is first. Autism is a neurodevelopment disorder with a wide range of signs or symptoms and ability levels. No two children diagnosed with autism share the same symptoms, behaviors, or characteristics. ASD is characterized by impairments in social communication. Children often engage in repetitive behaviors, and they have sensory sensitivities, as well as may show restricted interests as outlined in the DSM-5. So let's break it down further. Social communication impairments are when a child shows difficulties initiating and responding to social interactions. In practice, I have seen many children who will walk right by you without saying hello, or even answering a question you may ask. It's important to understand that the individual is not trying to ignore you, but rather that social skills are lacking. A part of social communication is also showing a lack of interest or sharing. Many children at a very young age will try to get their parents' attention to show them something, but children diagnosed with ASD do not show this. We also see a lack of eye contact, reduced use of gestures such as pointing or waving, reduced facial expressions, and limited imaginary play. Repetitive behaviors and restricted interests are when we see a child repeating words, sounds, or phrases. We may also see a child engage in repetitive behaviors with items such as lining things up or spinning a wheel on a car. Some children may also engage in repetitive physical behaviors like hand flapping, rocking, and so on. Your child may seem very rigid to routines and fixated on specific interests like numbers or letters. If your child is showing any of these signs, it's important to speak to your doctor and take the necessary steps to understand the autism diagnosis further and the best treatments. It's important to remember that many of these characteristics can be addressed in treatment. A treatment program will focus on communication and behaviors to support your child.
Created using Powtoon.